Adrian Vale was the hospital's golden surgeon, and Lena Marquez was the ICU nurse who trusted him. Until a wealthy patient named Charles Winthrop flatlined after a midnight visit caught on CCTV, exposing an affair, a secret payment, and a lethal injection that would shatter every life inside Crestview Medical Center. Dr. Adrian Vale was one of the most admired heart surgeons at Crestview Medical Center. His name was often associated with miracle recoveries and high-risk procedures that ended in applause from grateful families. He moved through the hospital corridors with quiet authority, his white coat crisp, his reputation spotless. Administrators valued him for bringing prestige and wealthy donors. Patients trusted him with their lives without hesitation. At home, he maintained the image of a devoted husband living a stable and disciplined life. To everyone watching, he seemed untouchable. When Lena Marquez joined the intensive care unit, the hospital gained a nurse known for precision and calm under pressure. She had traveled far from the Philippines to build a better future, working night shifts with tireless dedication. Her focus rarely wavered, even during chaotic emergencies. Colleagues respected her professionalism and steady presence beside critical patients. Long surgical nights slowly turned into shared glances across the ICU. Routine updates became extended conversations in quiet corners. Their connection grew in secrecy, hidden beneath clinical routines and sterile hallways lined with security cameras. Neither seemed concerned about being observed. Then Charles Winthrop, a wealthy investor and major hospital donor, was admitted with mild chest discomfort. His condition was stable, his prognosis reassuring. Hours later, in the stillness of the night, something shifted inside his ICU room. By morning, he was dead. What appeared to be sudden cardiac arrest would soon trigger questions no one at Crestview was prepared to answer. The first signs of trouble surfaced quietly, buried in routine procedures. After Charles Winthrop's sudden death, hospital administrators initiated a standard internal review. On paper, everything appeared ordinary. His chart showed stable vitals before midnight, no recorded distress, and no emergency intervention. The official note listed cardiac arrest as the cause. It was tragic but not suspicious, at least at first glance. A junior IT technician assigned to archive weekly security footage noticed something unusual while reviewing the ICU corridor cameras. At 11:52 p.m., Dr. Adrian Vale entered Winthrop's room even though he was not scheduled for rounds. 7 minutes later, Lena Marquez followed, carrying a small stainless steel tray typically used for medication preparation. There had been no code blue alert, no nurse call from the patient, and no documentation explaining their presence. The footage showed the door closing behind them. For nearly 40 minutes, no one else entered or exited. At 12:38 a.m., Lena stepped out alone, her face tense and unreadable. Dr. Vale emerged shortly afterward, removing his gloves and disposing of them in a biohazard bin before walking calmly down the hallway. At 3:12 a.m., monitors inside Winthrop's room registered a fatal flatline. The hospital's medication system showed no drugs administered during that time. Yet toxicology results, requested by the family, revealed dangerously high levels of a powerful ICU sedative. The discrepancy between records and reality was no longer minor. It pointed toward deliberate concealment, and the CCTV cameras had captured more than anyone expected. Once law enforcement became involved, the tone inside Crestview Medical Center changed from quiet concern to controlled panic. Detectives arrived early in the morning, requesting full access to digital logs, medication cabinets, and staff entry records. What began as a suspicious death quickly evolved into a criminal investigation. Biometric records revealed that the locked sedative cabinet had been accessed at 11:47 p.m. using Dr. Adrian Vale's fingerprint authorization. The drug removed matched the sedative found in Charles Winthrop's bloodstream. Minutes later, Lena Marquez's keycard was used to enter the ICU supply room. The timing aligned precisely with the hallway footage. Investigators documented every second. When questioned separately, both medical professionals maintained composure. They stated the visit was precautionary, claiming the patient had shown subtle signs of discomfort not reflected in the charts. However, ICU monitors store continuous data, and technical analysis showed no irregular heart rhythm or distress before midnight. The explanation did not match the evidence. As detectives dug deeper, Financial records exposed growing pressure in Dr. Vale's personal life. He had accumulated significant debt through risky investments and private loans. At the same time, Charles Winthrop had recently informed the hospital board of his decision to withdraw a substantial donation tied to upcoming cardiac research funding. The financial withdrawal threatened projects closely associated with Dr. Vale's professional reputation. Investigators began considering motive alongside opportunity. What initially appeared to be medical negligence was starting to resemble something far more calculated and deliberate. Forensic analysts enhanced the ICU footage frame by frame, searching for movements that might have been overlooked. The improved video revealed subtle details that changed the direction of the case. Just before entering Charles Winthrop's room, Lena Marquez paused near the doorway. Dr. Adrian Vale appeared to lean closer, placing something into her hand. The object was small and partially hidden, but its shape resembled a syringe. Lena's shoulders stiffened before she stepped inside. Investigators expanded their focus to digital communication between the two. Deleted messages were partially recovered from encrypted backups. The fragments suggested a secret relationship that had grown complicated. There were references to fear, pressure, and an urgent need to fix everything. The tone shifted in the days leading up to the death. Financial records added another layer. Shortly after Winthrop's passing, a significant deposit appeared in Dr. Vale's personal account from an unlisted source. Within days, a portion of that money was transferred to an overseas account linked to Lena. The amount was smaller, but still substantial. At first glance, it appeared to confirm collaboration. Yet detectives noticed the transfer lacked any direct communication tying Lena to the original source. It could have been payment, or it could have been something else entirely. Meanwhile, hospital administrators discovered that certain internal CCTV files had been accessed and edited by someone with senior-level clearance. The timestamps on Winthrop's corridor footage showed minor inconsistencies. Someone had tried to adjust the timeline, but not carefully enough to avoid detection. As scrutiny intensified, investigators reopened older patient files connected to Dr. Adrian Vale. One case stood out immediately. 6 months earlier, an elderly man recovering from bypass surgery had died unexpectedly during a stable post-operative period. At the time, the death was attributed to complications related to age and heart weakness. No one questioned it. The family had accepted the explanation without requesting further testing. Now, with suspicion surrounding Winthrop's death, detectives ordered preserved lab samples from that earlier case to be reanalyzed. Toxicology results revealed low but abnormal traces of the same ICU sedative found in Winthrop's bloodstream. The dosage had not been high enough to raise alarms back then, but it was present. Security archives were reviewed from that night. The footage showed Dr. Vale entering the patient's room alone after scheduled rounds. Lena Marquez had not been on shift. There was no record of medication being administered during that visit. This discovery shifted the narrative. If a pattern existed, it suggested that Winthrop may not have been the first victim. The possibility of multiple concealed deaths increased pressure on law enforcement and hospital officials. As media outlets began reporting rumors of a potential serial medical killer, public outrage spread quickly. Amid the growing storm, Lena failed to report for her next shift. Calls went unanswered. Her apartment appeared partially packed, and an international flight itinerary was found in her email history. To investigators, her sudden disappearance looked like confirmation of guilt, yet the timeline still did not fully align. Airport surveillance captured Lena Marquez moving quickly through the departure terminal with a single carry-on bag. She kept her head down and avoided eye contact, appearing exhausted rather than panicked. Investigators, already monitoring her movements, intercepted her before boarding. She did not resist. Inside her bag, officers found personal documents, a passport, and a small encrypted flash drive carefully wrapped in tissue. Back at the station, digital forensic experts examined the contents of the device. What they uncovered shifted the case dramatically. Lena had copied raw CCTV files directly from the hospital's internal server, preserving footage that had not yet been altered. The original timestamps differed from the versions investigators had initially received from hospital administration. The unedited clip showed Lena leaving Charles Winthrop's ICU room nearly 20 minutes earlier than the official timeline suggested. More importantly, It captured Dr. Adrian Vale re-entering the room alone after she had already exited. He remained inside for several minutes before calmly walking away. Forensic medical analysis determined that the lethal concentration of sedative in Winthrop's system aligned more closely with the later time window, when Dr. Vale was alone. Further review revealed that someone with senior administrative privileges had accessed and modified surveillance data within hours of the death. Lena's decision to secretly preserve the original files suggested fear rather than guilt. As the evidence was reconstructed, the investigation's focus shifted firmly back onto the celebrated surgeon. The narrative that once pointed toward a shared conspiracy began unraveling into something far more deliberate and personal. Airport surveillance captured Lena Marquez moving quickly through the departure terminal with a single carry-on bag. She kept her head down and avoided eye contact, appearing exhausted rather than panicked. Investigators, already monitoring her movements, intercepted her before boarding. She did not resist. Inside her bag, officers found personal documents, a passport, and a small encrypted flash drive carefully wrapped in tissue. Back at the station, digital forensic experts examined the contents of the device. What they uncovered shifted the case dramatically. Lena had copied raw CCTV files directly from the hospital's internal server, preserving footage that had not yet been altered. The original timestamps differed from the versions investigators had initially received from hospital administration. The unedited clip showed Lena leaving Charles Winthrop's ICU room nearly 20 minutes earlier than the official timeline suggested. More importantly, it captured Dr. Adrian Vale re-entering the room alone after she had already exited. He remained inside for several minutes before calmly walking away. Forensic medical analysis determined that the lethal concentration of sedative in Winthrop's system aligned more closely with the later time window, when Dr. Vale was alone. Further review revealed that someone with senior administrative privileges had accessed and modified surveillance data within hours of the death. Lena's decision to secretly preserve the original files suggested fear rather than guilt. As the evidence was reconstructed, the investigation's focus shifted firmly back onto the celebrated surgeon. The narrative that once pointed toward a shared conspiracy began unraveling into something far more deliberate and personal. With the restored footage establishing a new timeline, investigators intensified their focus on Dr. Adrian Vale's financial and digital records. Subpoenas uncovered a complex web of transactions routed through shell corporations and offshore accounts. One particular transfer stood out: a large payment deposited into an account controlled by a medical consulting firm that existed only on paper. That firm was traced back to a business rival of Charles Winthrop, a competitor who stood to gain millions from stalled hospital investments after Winthrop's death. Encrypted emails between the rival's private office and an anonymous address linked to Dr. Vale revealed coded discussions about removing obstacles and ensuring long-term gain. While the language avoided direct references to harm, the timing of these exchanges closely preceded the fatal night in the ICU. Digital forensics also confirmed that Dr. Vale's login credentials had been used to alter surveillance timestamps within the hospital system. The edits were subtle but deliberate, attempting to compress the timeline and obscure his second visit to Winthrop's room. Access logs showed the manipulation occurred from his office computer shortly before dawn. When confronted with the mounting evidence, Dr. Vale maintained his professional composure in public but requested legal counsel immediately. Behind closed doors, inconsistencies in his statements began to surface. His carefully constructed explanations no longer aligned with technical data. What once appeared to be an affair entangled in tragedy was now exposed as a calculated plot involving financial desperation and corporate betrayal, with the lethal injection serving as its silent execution.